Good morning. I'm Dr. Elena Sherwood. I am a relationship expert. I'm a relationship coach, and I am also a retired couple therapist. And I did that for 30 something years. So if you're here, say hello. Let me know where I find you today. I am here in Ottawa, Ontario, Canada. That's where I am. Okay. Today I want to answer a difficult question that many people ask me. And so it's really about how does a partner cope or deal with other partners' mental health episodes without taking it personally? So this is a difficult one because when we look at mental health issues, of course, it's going to affect the couple. Of course, there's no way around that. That's just how it is. And so, what are you going to do about it? Okay, so I wanted, let me just go backtrack a little bit and talk about what a healthy relationship has. Okay. There's a point to all of this, I promise you. So please stick around and hear some of this reasoning. So, healthy relationships, the foundation of healthy relationships include three things. You have to really like each other, love each other. That's the intimacy. You have to be committed to each other, as in, I'm not going to run, we're not going to run just because it gets tough. And then there's also the respect issue where we are going to treat each other with respect no matter what. So this is big. So when we're looking at mental health issues, though, the most common type of episode that I see is sort of a like an emotional outburst or like an angry kind of tirade or the silent treatment. I consider that an emotional reaction also. And so, whatever the reaction might be, these are only in that moment. And so, like everything else, what managing these are about what happens outside of the episodes. What happens before it, what happens after it, what's happening around it. So, believe it or not, the center point is not actually the episode itself. Okay, let me backtrack again. A healthy relationship would understand two very important things. Number one, we each have a role in playing with this mental health issue. There are two sides in a relationship. And number two, it's up to both of us to play our parts well. So if you are a person who struggles with mental health, it is the full load of responsibility sits on you to get some help and to keep up with treatment or to keep up in ways that need to help to manage your symptoms. That's not on your partner, that's not on your family, that's not on anybody else, but that's up to you. The second partner, the supportive partner, it's up to you. It's up to you to speak your mind, and it's up to you to let your partner know about how these behaviors are affecting you. Mental health issues it doesn't, okay, back to the first partner. Having mental health issues doesn't mean that you can now do whatever you want with your partner, that your partner is now it's like a dumping ground, or is now a garbage can, or is now a doormat. No, that's not how relationships work. And so it's still up to you to receive feedback from your partner. When your partner says, I'm done with this, I don't want to do this, and you can't do this to me, it's up to you to receive that well, because that's what we're looking at here, right? We're looking at partnerships. And so this is where it becomes really important for two people to come together and accept their responsibility. So the unwell person has to make sure that they're doing what they can to manage their symptoms, that they're doing everything they humanly can to kind of make that okay for themselves, without relying on anybody else. That is you're in the driver's seat. Nobody else is driving that but you. And it's up to the supportive partner to let them know. And so when I talked about what's happening around it and before it and it's after it, it's like outside of the episode, there has to be this mutual caring and loving of each other. And there has to be this mutual, we're going to do this and we're going to be grown-ups about this. And there also has to be the respect, is that we're both equal here. So we're going to make this work one way or another. And both of us are responsible for what happens. And so what does that mean? It means preparing ahead of time and having conversations about, okay, this is no news. If it were me, if I were the first partner, I have mental health issues and I have to deal with that. And what am I like when I lose control, or what am I like when I'm angry? I need to own up to that and I need to do better. And so the other partner, who is the supportive one, needs to accept the responsibility to say, I don't like it when you get really mad at me and take it out on me. And maybe that's something you can do outside of episodes. Maybe you can do that after the last argument or the last episode, or if you think one is brewing, have those conversations when you're calm. This is very important. And so I'm really hoping you've learned something here today. I had to do this live because it was just too hard to organize all of it. And so thank you for watching, and I hope this was helpful to you. Thank you.